So today I have another great interview. I have a guy who is a PA who has spent this winter doing something very unusual. He was working at a research station down in Antarctica, and today he's going to tell us all about that experience. So please help me welcome Joe Horniman. Okay, well, so that brings us to I wouldn't say the highlight of your career, because there's a lot of cool stuff I'm sure you've done.
No, it was definitely the highlight of my career.
Yeah, it's definitely a unique experience that not a whole lot of people can say that they have done for sure. So tell us what research station you were at, and briefly kind of just a general overview of your duties.
I was at the Amundsen-Scott South Pole Station in Antarctica, which is located at the Earth's geographic South Pole. And I was part of the medical support team. It was myself and a doctor. We were there over the winter, the polar winter, which lasts about 9 months. 6 of those months, the sun is down and it is dark. 24 hours a day for that time. So that was an interesting experience. But basically, we are there as medical support for the station. So during the winter there especially, there is no traffic in or out of the station. There's no ground traffic. There's no flying traffic. We were basically stuck there for 9 months, left to our own devices. And so it's a doctor and I, and we are the sole medical support for everybody on station, which is, including us, 39 people this year. In case of whatever happens, broken bone, hopefully nothing more serious like a stroke or a heart attack, but that's what we're there for. And anything else that can come up medically. It's kind of like you're on Mars. You got to have a medical team ready to respond to things, especially any kind of trauma. There is some heavy equipment there, heavy loads that need to be moved around. So accidents can happen. Luckily, we didn't have anything bad happen this year, but that's basically what we're down there for.
So I guess like with astronauts, the people who actually work in the research station, they must get screened pretty well for health and psychological fitness?
Yes, so we go through the PQ process, or physical qualification process, and basically you send in this pretty complete medical records form, and that's to the University of Texas Medical Branch in Galveston. They run the Center for Polar Medical Operations, which oversees all of Antarctica's stations, not just the South Pole. They staff the medical people there. They're my employer.
How many stations are in Antarctica, do you know?
The U.S. stations, there are 3. Total stations into Antarctica, I'm not sure. It's got to be upwards of 40.
Wow.
If you include every country's station. As far as the winter rover stations, I believe there's 22 or 23 that are actually staffed during the winter. A lot of them are only staffed during the summer, or just buttoned up and closed up for winter, and then they come back in the summer.
Yeah, see, that's something that I think most people would say, if you ask how many stations down in Antarctica, people would be like, 1.
The Antarctic station. Yeah. No, there's a ton. Most of them are on the coast because it's just such a rich area for Antarctic wildlife. There are very few stations on the interior. The South Pole Station is one of them.
What type of research is that station mainly focused on?
Most of the research that happens at the South Pole Station is astronomical and physics. We have the South Pole Telescope, as well as a couple other telescope arrays that are looking at the cosmic microwave background radiation. There are some climate science. The National Oceanic and Atmospheric Association, NOAA, runs a observatory there. So it's an array of experiments. The most prominent ones are the astronomy and the physics ones, though.
And I imagine, you may not know about this, but I would imagine each one of these stations have to have their own medical personnel.
All the U.S. stations do, for sure. So there's McMurdo, there's South Pole, and there is Palmer Station. The biggest station on the continent is McMurdo Station, which is a U.S. station. And it's where a lot of people come through, even other countries, before they go to their station. And that can have upwards of 1,000 people during the summer, maybe even 1,500, 1,800 people at max capacity. And there is usually 2 doctors, I think 2 nurses, a PA. Like they got a pretty decent sized staff for that clinic. There is, for South Pole, like I said, there's a PA or NP and a doc, so 2 of them. And then Palmer just has a doctor because it's the smallest station. It usually has only like 20 to 30 people there. and that's on the coast that does some biological research.
So how does the licensing work?
It's just any state license. Similar actually to the Indian Health Services, where I worked in South Dakota. They take any state license as well because they're a federal program.
During that 9-month span when you're there shut in over the winter, how many providers work there?
2 of us. So there's a doctor, station doctor, and then there's either a PA or NP as the secondary position, not physician.
And as another thing that's surprising to me, just like when I just interviewed somebody who was the PA working with the president and the vice president, not to put down our profession or anything, but I guess a lot of times you just would assume that it would just be physicians. Did anyone ever talk about what the reasoning is of that having a doctor and a PA or an NP?
The Navy station was established back in 1957, and since that point, up into I believe it was around 2000 and early 2000s, maybe 2004. I'm not sure exactly when. There was just a doctor on station, one doctor, and then there started to be some issues where the doctor themselves were getting sick or had some problems. There's a famous case. I can't remember her name off the top of my head.
Yeah, I was just thinking about her.
I read her book and now I can't remember her name, but she wrote Icebound, the book where she was a station physician at the South Pole Station and she got breast cancer, which was very unfortunate timing. Basically, it started growing right after she arrived and right after they closed the station. And she was just hoping and praying it wasn't cancer, and it turned out to be. So, that was just a series of unfortunate events, actually.
Yeah, that wasn't the one I was thinking about. Wasn't there someone that had an appendix and they had to operate on themselves, or was that a movie?
Yes. No, that's true. That's true. That was a Russian doctor in the 70s, actually, that happened to. Yeah. I was at a Russian station. But yeah, I think it was actually 1999 or 2000 was when this doctor, she had breast cancer, and actually they airdropped chemotherapy drugs in midwinter to the station. Besides going through the polar night there, which is not easy on the body itself and the brain and the mind, she had to also start chemotherapy there, I believe. And then all of a sudden you're kind of without a fully functioning doctor as soon as something like that happens. And there was another case where not the doctor, but one of the staff had a pretty serious medical condition that required 24/7 monitoring for weeks. Yeah. They weren't even be able to fully perform their job, because that one patient was taking their entire attention all the time. You're the only person there. You don't have any help. You got to establish all the IVs. You got to take all the x-rays. You got to call all the consults. You got to administer all the medications. You got to pull everything out of the pharmacy yourself. You're it.
Plus, if any other patients need to be seen.
Exactly, but they're probably just shoved off the back burner at that point. Unless you're also about to die, you can move along. It's almost like a mass casualty incident at that point, because MCI is usually termed whatever amount of patients or severity overwhelms your capacity to treat, and that basically is that. One bad patient overwhelms one doctor. And so around that point, USAP was and USAP is United States Antarctic Program. Okay. USAP said, you know what, how much would it cost for us to put a second provider there? Another doctor, that's too expensive. What about a PA or NP? Yeah, that's cheaper. Let's do that. There's an argument to be made that I am the most useless person on station, as far as how essential I am, because I'm basically there as a backup to the doctor. Obviously, since we're both there, we both split responsibilities, we split our hours and stuff like that. And we take on equal loads. But, the real purpose of me being there is if he gets a patient he can't handle, if it's serious, or, he himself gets sick, or he or she.
Obviously, you're there for any major, critical things that happen. But on a day-to-day basis, what kind of conditions were you seeing? How often were you seeing them? And then what were your other duties or responsibilities, if any?
Our duties are fairly light as far as actually seeing patients because, like I said, we do go through the physical qualification process, which weeds out anybody who's really high risk. And then on top of that, there's only 40 of you. So the chances of something really going wrong is very, very low. So you end up not really treating a whole lot. Maybe somebody's allergies flare up when we go trimming stuff in the greenhouse. But other than that, there's really no allergens around there. There's nothing growing except what's in the greenhouse. So we deal with a lot of low-key trauma, people break their toes, break a finger maybe, or get a little frostbite. Maybe get even worse frostbite where they lose a little bit of tissue, something like that. But you don't do a whole lot of extreme patient care. As far as what you do the rest of the time, there's a fair amount to do because you're the only two people there. Everything has a maintenance schedule, whether it's the x-ray machine or the 3 ventilators you have or all the defibrillators you have around station. Everything has to be checked periodically. So you have a whole spreadsheet schedule on how you're going to verify everything's working properly. Beginning of winter, we do a pharmacy inventory where every single pill in the pharmacy is counted. That was my project for the first couple weeks. And we actually have a pretty comprehensive pharmacy for how remote and how small the clinic is. Now, as far as the depth of how many bottles or vials of a medication we have isn't that deep, but we have a pretty big variety. So UTMB, from what I know of the process, they order all the medications from all the different vendors to UTMB and then package it up in their own packaging and then send it through New Zealand, has to clear New Zealand customs. And then it finally gets shipped down to McMurdo and then from there to the pole. So they try to get a jump on things as early as possible. When we came in February, our medications were like on one of the last flights in.
And when you say last flight, for people who don't know, there's a window where flights can come into the South Pole, but then once the winter kicks in, you are, as you said earlier, you're literally cut off. There's no flights coming in. There's no way to get to the station. So anything that's going to get there has to get there before that window closes.
So it's possible to fly in the middle of winter to pole, but it's very, very, it's dangerous. It's not something you'd want to do routinely. And it has to be for a really good reason, generally a life-saving medevac or something like that. And it's not just that, the pilots are sitting with their planes at McMurdo and they could fly over, but they just don't want to because it's dangerous. Actually, once winter starts, all the pilots and planes leave the continent and go back to wherever they're from. Our main contractor is Ken Boric Air, or KBA, in Canada. And so if we want to rescue or need a medevac or anything like that, they've got to come all the way down from Canada to retrieve whatever we need them to retrieve, a patient or whatever. So it's not just dangerous, but it's still a logistical nightmare. So yeah, it generally does not happen at all in the winter. Once station closes, that's it. And then at that point, you're on your own, which is a funny feeling. Definitely a little bit of anxiety as you see the last plane leave, but then I felt mostly excitement. I thought it was pretty cool.
Are you able to perform surgery if you need to?
Not really, no. Now, if it was something life-threatening surgery-wise, the doc and I know how to do a cranial burr hole if we really had to, but do we want to? No.
Right.
We'd have to be pretty we'd have to be pretty convinced that this is it's like this or death before we're going to do surgery. And our policy on appendectomies, so everybody that goes down doesn't need their appendix out. It used to be the case. It's not the case anymore.
Oh, really?
Yep. And that's just because antibiotic therapy has progressed.
Right, even in the regular ERs, they're being managed a lot more just non-surgically, right?
Exactly. So sometimes it's curative, but even if it's not curative, it's a great temporizing measure. So our policy is, for USAP, at least at the South Pole, is just load them up with antibiotics, stabilize them, and then call the medevac immediately and see how quickly we can get them out. So we do not have an OR. We do have sterile instruments, but I would not want to have to try to do surgery there. It'd have to be a last ditch attempt for sure. But we have ultrasound, we have X-ray, and the whole computer setup for reading X-rays digitally. We can do dental X-rays too. We have a whole dental suite with dental tools. We have a lab with all your basic labs like a CBC, CMP. We can do lipase, all the cardiac enzymes, D-dimer, all the stuff that you frequently order in an ER. We could do. Striker stretcher right here, of course, with our go bag.
Is there power 24/7, or do they cycle through power?
There are 3 generators. Each one of those generators could run the station. So it's extremely reliable.
Just in general, kind of how big is the station, and what was your sleeping quarters like?
So the station is much bigger than most people realize. I'm not sure what people imagine. Maybe they're imagining the space station or something like that, but it's pretty big. The inside livable space, I think, is about 60,000 square feet, which is about the square footage of a football field, if you imagine that. If you add in all the utility space, it's even more than that. But that's the elevated station. So it's pretty big. It can house up to 150 people. The rooms you get aren't that big. They're pretty small. 8 by 10, I believe, maybe 7 by 10. It's pretty tiny. It's enough for a twin bed, and that's about it. But they are your own rooms. You don't have to share rooms. Now at McMurdo Station on the coast, they can have a lot of people during the summer, and then everybody's sharing a room. So you don't get your own room there.
And communal bathrooms, I assume, are shared facilities.
Yes, definitely. Communal bathrooms. And like I said, you can see the tour of all that on my YouTube or my TikToks as well. But it's a very livable space. It's a little bit like college. You know, you're in your own little dorm, and then you have to share a bathroom, and then you go to the cafeteria where everybody eats. You know, it's very much a shared space kind of environment.
Well, that's so cool that there's a greenhouse, because that would be really hard just eating, prepackaged food all the time and not having anything fresh for 9 months. That's a long time.
Yeah, basically all our food is, if it didn't come out of the greenhouse, it has to be able to be frozen or powdered. Yeah, the greenhouse is amazing to be able to have that. Now, it's not huge. It's not like we have big old orchard of orange trees in there or something. Mostly it's things that grow on a vine, or tomatoes or cucumbers or leafy greens like spinach and lettuce, things like that. But we're able to get probably a fist-sized salad every day, which doesn't sound like much, except it's like life-saving.
Right.
That's all the green thing you have, and it's either that or nothing. It means a whole lot.
I assume that there are some researchers that are going out of the station, but were you pretty much indoors the entire time, or did you get to go out as well?
So I loved going outdoors, and being medical, we kind of have free reign to do what we want. And I took that as a license to accompany scientists all the time whenever they were going outside to their stations or doing rounds on their science equipment, just to make sure it's working properly still. And while I was out at the outbuildings, I was usually checking the medical equipment out there, or the AEDs, making sure they were functioning properly. That was my excuse for going out there, at least.
Does the South Pole have anything like the Northern Lights?
Absolutely. We got them very frequently this year, actually. It was really cool. Just about any time of day or night, you could walk outside and see some, and then very often they would flare up into like these really bright green bands across the sky, and purple and reds and yellows. It was really cool.
Yeah.
Very cool. One of the coolest things I've ever seen.
So the whole mental aspect, did you have any challenges with that? And what was it like what you thought it was going to be, or was it claustrophobic at any time?
I was on a pretty good high just from being there, and kind of I've been wanting to get down to Antarctica for a long time, since I was a little kid. And so just being there was awesome. And that kind of carried me through a lot, especially into the dark polar night. But by the time it got to about mid-July and August, I started to drag pretty hard. Had a lot of symptoms of SAD and seasonal affective disorder. I was getting fatigued really easily. I felt my sleep requirements just go way up. Just lack of motivation. Like I didn't want to go to the gym as much.
That's what I was going to ask earlier. So there is a little gym there you can work out.
Yeah, actually pretty good size. There's a weight room, which has like all your treadmills, rowing machines, bikes, exercise bikes and everything. Then there's one entire pod, which is kind of like a wing of the station, is dedicated to a sports gym. So like a basketball court, basically, which can also be converted into a volleyball court, badminton, indoor soccer if you wanted to do that, street hockey, whatever. So I thought that was really cool. You're there all winter, man. You just really look forward to like some of the things every week. And one of the things I look forward to was volleyball, which we played twice a week. That can really get you through a lot. It's good for bonding. It's good for the community. It's good for your mental health to have that exercise.
Right,
and
just the natural endorphins from exercise in general.
Exactly. Exactly. So I think it's really great that they have that. So yeah, I had a kind of a rough patch in late July. I had just gotten done helping coordinate our South Pole Olympics, which was like a big event for like a whole week. We did all these events, and that was kind of like a big high, and then that was done, and then all of a sudden I realized how many of these symptoms of SID I was struggling with. It kind of crashed on me all at once at the end of July, and then I didn't really kind of come out of my funk until September. And I knew as soon as the light started coming back, like I was going to start feeling better. And sure enough, as soon as I started seeing some light on the horizon, your brain starts resetting. You're like, oh yeah, sunlight, that exists. Yeah. And physiologically, your brain starts kind of getting back to normal. For me, at least, that's how it was. So yeah, it can be tough, and I know some people have a tough time as soon as the sun goes down, and that's bad. Some people have no problems the entire winter. So it really just depends on who you are.
Do you end up putting people on antidepressants?
That's definitely an option. We do it within consultation with psychiatry back at UTMB,
Oh, okay.
which is really great that we have them available.
Is there any problems with communication ever get disrupted?
Our good internet satellite is about 5 hours a day. While that's up, we have great voice quality calling back to the States. And then the rest of the time we have an Iridium satellite phone, which we can reach anywhere in the world, anytime a day. But sometimes the quality is a little iffy. So you're not totally cut off communications wise. You always have the red phone option,
Yeah.
to call somebody, which is pretty great.
So let's talk about how this opportunity came to you, because we had talked a little bit earlier, so I know that you didn't quite go the traditional route. So if you'll talk about usually how, people do this, and then what happened that you got to bypass some of that.
Really, I first learned about like the medical side of the U.S. Antarctic program when I was in the fellowship at UIHC, University of Iowa Hospitals and Clinics in Iowa City. I took a wilderness medicine course as one of my electives in the residency, and the teacher for that, his name is Dr. Chuck Huss. He was the station winter over doctor at the South Pole in '81, I believe. And he gave us a whole presentation of what it was like to work at the South Pole in the '80s, in the old station before this nice shiny new station was built.
Yeah, I'm sure it was different.
And I was just fascinated by it. And then, so as soon as I graduated from the residency, I applied at UTMB's website, for the position. I applied then, I applied the next year, I applied like every year. And then finally last year, I had just gotten back from traveling, and a bunch of my other jobs just fell through at the last second. Kind of frustrating. Right during the pandemic, people weren't sure if they need you, if they don't need you. Anyway, I guess out of frustration, I just emailed UTMB, the hiring coordinator for them. And I was like, listen, as politely as possible. But what I was thinking was, listen, like, what are you guys looking for this position? Like, I have 4 years rural ER experience. I've done a residency. I have the CAQ. Like, what are you guys looking for? Like, what could I do to make my resume look better? I finally got a response from them. It was like, actually, we are looking for somebody like you. And I was like, great. And I just went back and forth, and it eventually landed this job. So always send follow-up emails, I guess, is the moral of the story for that.
Right. I mean, if there's something that you want to do, I've heard this so many times, if there's, any way that you can contact people and do follow-up, you never know when you're going to make the call that's just at the right time, like you, and then you get this opportunity.
True. And you never know. Like, I actually had emailed them right at the time that they had this opportunity come up. And so they originally were thinking of me because of COVID, and they were trying to add as much redundancy in their medical staff as possible. They were worried about the single doctor at their Palmer station, which is the smallest station. They're like, maybe we need to add a PA over there. And they're like, we're considering adding this position. We'd love you to be that person. I was like, great, I would love to go to Palmer Station. Right. That sounds awesome. And then they got back to me about a month or two later and was like, actually, how would you like to go to the South Pole instead? Because our person for the South Pole just said that they couldn't, they can't make it this year. I was like, that sounds pretty cool. I'll do that. I think a lot of people do some years or seasons at McMurdo and then end up going to the Pole. So I feel very, very lucky that I was able to go straight there.
So do you think that you might in the future apply to work at Palmer or Murdo just to experience something different down there?
I could see that. For me, I think if I could rank them in order, I'd do a summer or winter at Pole again. I would do either of those at Palmer, like a summer at Palmer. And then maybe if all those were exhausted, I would do something at McMurdo, maybe a summer at McMurdo.
Is that how they're normally staffed? Is either like you do a summer or you do a winter?
Yeah, so medical staff generally is only for a season, either the short summer season, which is 3 months, or the long winter, which is 9 months. One last note, I guess, if you're looking for other thoughts, is that it is weird to work at a place where all your coworkers are also your roommates and also your potential patients. Yeah. I guess people who've done military time, it's not so different because it's probably the same thing. But you have to start building some boundaries in your mind over like what's personal, what's professional, and everything. Because it's not like you go to work and okay, now I'm in my work mindset, and okay, now I'm home, now I'm in my home mindset. Because there it's the same thing. Like your work is your home. Our clinic is right here in A pod. Let me take you in. So if you come in here through the vestibule, and here is the lab with another door into the pharmacy. And this is actually my office. A little bit of a mess right now, try to ignore it. We're in the middle of trying to transition and clean things up for the next crew that's coming in here. For how isolated we are, I was actually impressed when I got here. So coming further into the clinic, we have our main patient treatment area through here. And there's our bed, our crash cart over here, our defibrillator, ventilator, our main ventilator. We have several backup ventilators as well. Ultrasound, all our equipment, drawers here, IV pumps, etc. And then we have our telemedicine station, where often we'll call over to McMurdo Station, where they might have a physical therapist, which we don't have here, and they can help us with a patient who might be having back pain or shoulder pain and help us do some rehab for them via telemedicine. Over here we have the dentist's area. We rarely use this, but we are trained in some very basic dental procedures and all our dental equipment over here. We also have our portable x-ray machine right down here, and our x-ray cartridges and readers over here, our 24/7 Iridium phone line over here in case we need to call back to our medical support. Come through here. If you're wondering, we had the plastic up because of COVID. We have not had a COVID patient here at the South Pole yet. We're hoping to keep it that way, but if we needed to take any isolation precautions because we have a COVID patient there, we could shut this. We have not had to do that yet, but again, we can go through some more plastic over here to the inpatient area. And here we have the inpatient bed, Manny the mannequin sitting over there right now. I think this is probably the best view out a window at the station is from this room, and that's because we get to look straight out at the ceremonial South Pole, basically right in line with it. Makes for great pictures, great time lapses. You can see all the way over to the Atmospheric Research Observatory way out there, and then the dark sector buildings way out there, which are kind of just silhouettes right now. We have not had to have an inpatient this year. I hope that continues. We've had a very healthy year so far. Coming out of here, we've got our Stryker stretcher right here, of course, with our go bag, and our ACLS medications, and then through here is the station doctor's office. Dr. Lee, who's not in here right now because it's 3 in the morning. Another exam table here, and that's basically the entire clinic.
I'm so excited for you that you got to have this opportunity in life, and thanks for sharing with us. And just thanks for being here, Joe, and I wish you all the best.
Thank you so much, Michelle. It was a pleasure being here.
Again, don't forget, if you want to see really cool videos and more about what it's like living in the South Pole, make sure that you check out Joe's YouTube and TikTok.